Hi everyone, as you see here in this diagram, we have an emergency situation. It's one of the most critical situations in obstetrics. As you see here, there's a huge blood clot which is formed behind the placenta of the baby, leading to separation of this placenta. Literally speaking, the patient here has an internal bleeding that no one can see easily, unless the blood clot starts to go out through the vagina and the patient will notice huge amount of bleeding trickling. This is usually called the retroplacental hematoma, results from a hemorrhage that collects between the placenta and the uterus as you see, separating the placenta from the uterine wall and often leading to a significant maternal and fetal compromise. The bleeding is almost always of maternal origin from the mother's side, secondary to rupture of small arterioles, and that leading to a shearing mechanism at the placental bed. One of the most commonly known reasons is chronic hypertension and preeclampsia during pregnancy. Those are strongly associated as risk factors. Abdominal trauma, where you have any blunt force to the abdomen, including motor vehicle accidents or domestic violence, those are all can precipitate abruption and hematoma formation. Cocaine and amphetamine misuse increase the risk by inducing vasoconstriction of the vessels and hypertension. There are other risk factors, for example, polyhydramnios, where you have an excessive amniotic fluid around the baby, advanced maternal age, where you are over than age 40 while you are pregnant, and low maternal body mass index, rupture of the bag of water around the fetus, and one of the most important also risk factors are IVF and ICSI, and if you have a tendency for increasing blood clots in your body, where we call it thrombophilias, disorders. And now we are going to see a real life scenario for a patient that we managed to resuscitate her and save her life, and at the same time save her womb for fertility preservation at the same time. This the case, as you see, was presented with a huge amount of bleeding and with severe anemia and in a state of shock. This is the fetus or the baby which is coming out from the womb, and you will see we will take the womb out of the tummy and you will see huge amount of clots formed. Those clots found behind the placenta, and as you see here, this is the placenta and this is the blood clot behind the placenta, the black spots as you see, or black masses. This is the placenta and the black masses behind, and that would make the fetus will not have a good blood supply and will have an immediate death regarding this situation. We send the placenta for the histopathology examination to try to know what is the real cause, and we see the baby examination also and briefing the mother. For watching, I will take any of your questions in the comments. This is Dr. Wael Banna. Thank you so much.